Hi, I'm Dr. Huffman, Clinic Director for the Landover office of Kaizo Health. And a frequent question about chiropractic adjustments is this: are they safe? Well, it's a good question, and the short answer is yes, they are. There's a risk to doing any kind of medical procedure to the human body, but spinal manipulation is a very safe treatment to help restore spinal signal function and to reduce pain and get you back to life. The biggest area where there's a risk would be in the neck or the cervical spine, because you've got blood flow through two arteries on either side of the neck. Many times patients have, or stories have been reported where someone had a stroke after receiving a cervical adjustment. That can happen. It usually occurs if the patient is not truthful about their background, or if the doctor is negligent and does not perform certain tests to help ensure, at least at this moment, that manipulation is safe. But going through and getting the treatment is going to help restore proper function. It's a minimal risk, and it is something that I encourage people to take advantage of if they've had some kind of an injury. Now, let me address several questions sent in by patients online. First patient asks, what is safety in healthcare? I know that's a very broad question and not one that's easily answered, but first of all, safety in healthcare is making sure that the procedures, the evaluation, are done in a manner that ensures that the patient's health and safety are not compromised. So, as an example, a patient comes to see me, they've got neck pain. Doesn't matter if it was caused by a car accident, a slip and fall, or a sports injury. I need to make certain, as best I can in the office, that they're not going to have a stroke. So there are several orthopedic tests to perform to help ensure that in the office there's no evidence that a stroke is impending. You perform the tests. If they're all negative, then it is safe right then and there to do the adjustments. If you have any question about the result, if you're just not sure, if there's some little voice in the back of your head that says, I don't know, maybe, listen to that voice. Don't do the adjustment. Have the patient evaluated by medical authority to make certain that they're not going to have a stroke. Another question just sent to me is this: what makes one chiropractor more safe than another? Again, a very good question. A lot of it comes from reputation and how that chiropractor performs their job. So if anybody says to me, how can I know if this chiropractor is good? I would recommend first checking with the state licensing board, seeing if there are any sanctions against the practitioner's license, whether it's in the past or present. Secondly, go to Google. Do a Google search about that doctor or about that practice and look at the reviews. If you see a preponderance of reviews that are negative, then that sets a pattern. And I don't mean negative in the sense that they had a bad interaction with a staff member. If there are comments made by the patients about not feeling safe with that practitioner, you've got to pay attention to that and move on and look for someone who doesn't have negative comments about safety. A third question just sent to me is, how safe is chiropractic compared to other pain management options? Short answer, it's very safe. Chiropractic and rehabilitation focuses on restoring function. We can't always get rid of the pain. We can help manage it, reduce it. I'm a chronic pain patient myself, and I get adjusted periodically, and I go through my exercise routines on a daily basis, and it's very safe. There are times when patients do require narcotics for pain management because of the amount of damage done or the severity of the damage, and that too is appropriate. But I would always recommend trying rehabilitation first, and including chiropractic when it's appropriate, to help reduce that pain management, and then moving on to medicine as a second step. And eventually, if surgery is indicated, that's the path of the last step you should take when it's absolutely required. All three are appropriate, but if you're talking about what should be done first, always take the least invasive approach first. The last question sent asks if there are any conditions that a person should not see a chiropractor for. And for me, for the way I practice, I stick with rehabilitative issues, so injuries. There are medical conditions that are not appropriate for treatment with chiropractic. If you have a common cold, if you have the flu, that requires medical management. There are no studies performed, for example, high blood pressure. There are no studies that show spinal manipulation of the cervical spine helps reduce blood pressure for a long period of time and helps manage it. It just doesn't exist. Whether it's not been done, well, there have been studies done, and they just don't have the evidence to back it up. That's why medicine is appropriate for certain conditions, and then chiropractic is appropriate for physical conditions.